This podcast is brought to you by the Mental Health Advocacy Network. MHAN advocates for a consumer, family-driven mental health system of care that provides an array of service choices that are timely, responsive, and effective. Our vision is for every North Dakotan to have access to the right service, whether it be preventative, treatment, or recovery, at the right time, when the service is needed, and at the right place, as near his or her home as possible. To learn more about MHAN, our advocacy efforts, and literature about the North Dakota mental health system, visit our website at www.mhan.org. Again, our website is www.mhan.org.
Howdy, everybody. Welcome to another MHAN podcast episode with me, Patrick Kirby, friend Matthew McCleary. We're going to be talking with a very special guest today, Siobhan Deppa. She is the president of the Consumer Family Network here in North Dakota. Siobhan, welcome to the MHAN podcast. How are you?
I'm doing great. Thank you for asking me.
I am very glad to be on the show today. And I think kind of before we get started, I'd love to kind of get the audience and the listening crew here to kind of get this 5,000-foot view on who you are and your perspective, of course, before we dive into a bunch of peer support conversations and mental health conversations. So kind of who you are, what you do, and why we're talking today.
Okay, well, Patrick, my name is Siobhan Deppa. I am the president of the Consumer Family Network. I'm an individual with lived experience in North Dakota with a mental health condition, and also I serve on several different advocacy organizations for mental health, and I've just become involved with the whole consumer movement in North Dakota for mental health.
Outstanding. Can you give us a range of places that you kind of work with and work for and kind of have in addition to your president of the CFN?
Okay, a lot of them are just volunteer work, and I am a citizen member on the Olmsted Commission. That's a state commission. I am also a consumer member of the Mental Health Advocacy Network. I am on the CFN, and also I am a trained peer support worker through the state of North Dakota, and also trained in peer support professional through Mental Health America.
I love it. Before we kind of kick into a couple of things, and it's how comfortable you are, I would love, and I think everybody else would love to kind of frame this out, if you're comfortable kind of sharing your own personal recovery story.
Yes. Well, back in 1995, a while ago, I was diagnosed as being bipolar. I was living in California at the time. I had no real knowledge of any sort of mental health. I was unfamiliar with anything with mental health, really. And I moved back from California to North Dakota, where I've been born and raised and my parents live, so I could receive care at the hospital in Bismarck, where I was more familiar with, what they do for mental health around the state. And I also had my parents also as my advocates here. And it's been, a long time since then. And since 2002, my bipolar, I found the right medication finally. And my bipolar has become, I like to say stabilized. I'm probably using the wrong terminology, but I like to say stabilized with medication. And also since 2010, I quit drinking. And since 2018, I quit smoking tobacco. So that's been pretty much my whole recovery story in a nutshell, but there's been a long story behind pretty much all those years. So.
And just to backtrack a little bit, I've known you for a number of years, and if anybody knows Siobhan Deppa, they know that she's really proud of her own family history. So, and you also mentioned just a second ago that your parents were your advocates. So could you briefly share information about who your parents were and very briefly how you continue to honor their legacy?
Well, my parents were Patricia and SF, better known as Buckshot Hoffner. He's a lifelong resident of North Dakota, and I grew up on a farm in Esmond, North Dakota. My dad was executive director of the Centennial in 1989. He was also a local legislator from Esmond for a number of years. And he set up a town known as Buckstop Junction in the outskirts of Bismarck, a historical village after the state centennial. And my mother is pretty much my best friend. And, they're just lifelong advocates for me. I couldn't have done it without them. Their support to me has meant the world. And I always wanted to give back something because I grew up in a family where volunteering and also public service was very important. And you don't get rich at it, but you do make a difference.
Well, that's okay. I think the get rich, no, that's fine. Making a super awesome impact, way better. So I really think that I'd love to know a little bit more about the consumer movement. As somebody who doesn't maybe know what that means, how would you define that? What is a consumer movement?
Okay, the consumer movement in North Dakota is picking up steam, but it's been there for a number of years nationwide. I became familiar with it back in 2013. I was asked to testify to the state legislature on the benefits of a program that I had recently participated in called Peer Support. It was at that time, it was a federally supported grant, I believe, across the state. And I volunteered to have a peer support worker assigned to me. And I had just quit drinking. And so it was important for me to reestablish my life that didn't revolve around alcohol. And she was just the most wonderful thing. She helped me basically more than AA or anything else for support. And my mother had recently passed away also. So she helped me get through that and not slide into a depression that I might have slid into having bipolar. And in a house full of my dad and my husband, with caregiving, it was really a breath of fresh air that she could come in and be another female as a supporter with me, because I was really missing my mom and I really needed some perspective on my caregiving and my life in general. So that's kind of how I became familiar with the consumer movement, because it all started with my receiving peer support from someone else and all the opportunities that it opened up for me, and that it's just become right now for me.
In a nutshell, Siobhan, how would you define what peer support is? And, who are these people that are providing those services?
Well, for people who aren't familiar with peer support, I'd like to say that peer support are trained individuals that also share in my case, mental health and a alcohol addiction, and also they provided support as a paid support. It's not friendship. It was her coming into my home, being trained, really knowing the heart of where I was coming from. She was able to share some inside experiences that we've had with what we've went through in our life. Also being single parents, how that affected us. She was able to refer me to some great organizations that helped me with other support. She also just made me not feel alone. We were able to go to the mall together, just go out and social into public, where normally I would have this high anxiety where I wouldn't feel comfortable. She gave me my confidence back, my self-esteem. So that's what I want to say, that how it helped me and how it made me feel.
With that particular sort of experience with peer support, and I know you've been a big advocate for the availability of it, sort of throughout the state of North Dakota. As you take a look back, kind of, can you maybe reflect on some of the priorities that you had, the biggest ones, and then maybe what you feel is a giant success that you've had so far?
Well, for myself, being able to testify to the legislature that how important peer support was to myself and to how it could benefit other consumers with mental health across the state. I think that we got a band together with the Protection and Advocacy of North Dakota. We were able to get a band of peer support folks together to go to the legislature and ask for peer support across the state. That was one of my major draw for why I became more outspoken for the benefits of peer support. Also, just getting people together for conferences through the Consumer Family Network, so that we have some networking going on, so that people aren't feeling all alone. North Dakota is a very rural state, and folks who have mental health or anything else in the state regarding behavioral health, they don't all live in the city, and they don't have access to recovery centers or to self-help groups or to AA, NA. So it is important that we do have these occasions when we can get together for conferences, and with the recovery centers also, so that we don't feel so isolated, and that we know that there are others out there that do care about us and that do share the same behavioral health diagnosis.
And speaking of conferences and getting people together in North Dakota to express how important peer support is, this isn't just a local or state thing. The consumer movement, it's all over the country, right?
Yes.
And so I went to this thing called Alternatives, a big conference nationally. And were you ever in attendance to one of those conferences? And if so, what was that kind of like?
Well, after I testified for the legislature, I was asked to attend the Alternatives Conference in Austin, Texas. And I didn't know anything about the peer movement then at all. And so I said, well, yeah. So I was taking care of my husband, and I was able to put him in respite care at the VA in Fargo, and they watched him while I went to Austin, Texas. I got to fly out with other consumers that I had never met before, and also some professionals. And it was exhilarating, to say the least. The conference was run by and led by other consumers with mental health. And it was just wonderful. There was storytelling, sharing. There was, I want to say, different sessions on just pretty much everything under the sun that you might think of regarding behavioral and mental health. There were such great leaders across our country. I got to meet Patrick Kennedy, and he was one of the Ted Kennedy's son, and he himself shared his story with having bipolar. And there were several other famous people there that shared their story, and there were real connections made, and it made me even more and more passionate and just more intrigued with what I could do to help out others in the state and myself and across the nation. So I did get to go to the Alternatives in Austin, Texas. I got to travel the next year to Florida and also Orlando, Florida. And then I got to go to Memphis, Tennessee. They had it the next year. And that was the last one that I actually got to go to because my husband's health took a downturn and I had to stay closer to home. But those alternatives really, really helped me connect with others. There would be no other way myself probably could get that information. And having it shared with me personally, one-to-one, networking with people face-to-face, it really helped me. And I think it helped everyone who ever went to one before.
It's like a conference-going peer-to-peer group. It's peer-to-peer conferencing is what you've got there as well. It's sort of going to conferences, speaking at conferences, being part of the legislative process and getting to talk with some of the leaders at the state. Fantastic wins galore for I think, peer-to-peer support. My guess is this not all sunshine and rainbows and puppy dogs and ice cream. There's some real sort of challenges out there, especially in North Dakota. Can you kind of maybe talk a little bit about what are the biggest hurdles that we're facing in North Dakota as it pertains to sort of peer-to-peer support?
Okay. I know in North Dakota, our suicide rate is very high. Our rate of alcoholism is very high. What's normal here to drinking alcohol, and I can say this as a alcoholic former person who consumes mass quantities of beer, is that it's normal for us to drink a lot here in the state, and it's something also people are proud of. But in other parts of the country, it's not so normal, but here it is a real issue. And also across the state, like I said, it's a rural state, and there's a lot of isolation that occurs for people. And not everybody is connected to the internet or the cell phones. That's technology is rather a little bit newer. So, it makes it lonelier for people. And I think that the more that we learn and the more we open up and share and understand where we're coming from, especially when people had to isolate during COVID, I think that made everybody do a recheck on their mental health and how important connecting to people was. Well, we've known that as mental health and behavioral health consumers before even COVID, the dangers of isolation and how lonely it can get. So I think that we need to get more focus on peer support for the mental health consumers and its importance across the state on a one-to-one experience. Try to keep people out of the hospitals and from isolation, and try and keep people from harming themselves, and just bring a real recognition to mental health across the state. It's hard. And it can be really hard when you're going through trying to find the right medication, and everything that I went through for 7 years, it was really hard. And I can totally relate to that with a lot of people in the state. And we need to just make the numbers drop a little bit.
When it comes to what you discussed about the pandemic exacerbating North Dakota's ruralness and isolation from one another, as a fellow peer support specialist, I do kind of wonder, has peer support been given a lot of additional attention and recognition from our government, as well as from the human service and medical field? Do you believe that it has had an increased level of recognition and support? Or is there a limit to the extent to which there has been that support towards embracing the desire for peer support?
Well, for all the years I did testify on behalf of the legislature to be in support of funding peer support. Actually, peer support funding across the state was only made possible through a justice reinvestment piece. Where people that were coming out of jails received peer support as part of a greater program. So that's how mental health peer support got its foot in the door, really. But there needs to be more focus, I believe, on individuals with mental health or any behavioral health issues, also receiving the same peer support and the same peer support training and everything that's made possible through the justice reinvestment piece. It needs to be a little bit more, be like the program, or be the accessibility, at least, of the program that I initially was in when the federal government had the grant for the 2 years, which I had peer support. That's when I really could understand how it could be useful for others with mental health. The peer support that we have now, it's wonderful that we have it, but we need to try and get it to everyone. And we need to try and get the people that have been trained in peer support jobs, try and get them matched up with people with jobs across the state. There's so much more that can be done, and that people are just learning about peer support. I don't think it's like a mainstream thing yet out in different communities. And I don't think a lot of communities even have heard of peer support yet, especially the smaller, more rural ones.
Well, following up on that is, do people understand what peer support is, and what are some of the maybe misconceptions? If you hear it out in the West and it's not familiar to you, what do you think it is? What are people talking about it, and is it radically different than sort of your interpretation?
Well, through my interpretation, I guess I would have to approach it as I initially approached it when I received peer support for the first time. I didn't know what the program was. I didn't know what to expect. When I talk to others regarding peer support, they don't, they haven't had it except for the same program I had through the recovery centers. That was the only time the other mental health consumers actually experienced it. They've been streamlining the human service centers in the state, and a lot of the, I'll say it's longer term SMI folks that have received peer support probably wouldn't have access anymore, not having case managers and just having access, but pretty much just to the psychiatric services that the human service centers provide. And without actual peer support, knowing about peer support is hard, I guess. It's hard to reach everyone. And so I guess people don't understand what it is. Peer support to me was really on the rise, more so when we were actually having conferences through the Consumer Family Network, our annual conferences, which we haven't had in a couple of years. We were able to reach more of our mental health consumers and able to get them more information about where they could find out more about peer support in their communities or in their areas.
So it sounds like the general public or people that would qualify to receive peer support services don't necessarily know what peer support is and how it might help them. Are there any misconceptions or lack of awareness from the professional body about what peer support is and how it's beneficial? Or, for instance, are there even any misconceptions about the people that do provide peer support services?
Well, I don't think that enough people actually do provide peer support services. I don't think that it's so much as a misconception as much as just a lack of knowledge. There's just like totally folks don't know where to go for peer support. What do they do and think of peer support? Is it different for mental health as well as from different behavioral health? Is it different through folks that have addiction or people that are going through just different ways of behavioral health? I guess that's not a very good explanation, but there's different ways to approach peer support in the state. And the mental health consumers and the consumers that have addiction issues, as well as the consumers that are possibly in other programs like with the Justice Reinvestment, the Free Through Recovery, they all technically have access to peer support. But where do you find the peer support? If you qualify, you have access, where do you actually find it in the state? And how can you find it?
So there's a lack of access to the services themselves. Are there any issues that people face when they become peer support specialists?
Well, when they become peer support specialists, it's actually getting matched up with someone to give peer support services to. Getting employed by someone, or it's hard to find the people that really want the peer support. Without going through the human service centers anymore or going through the recovery centers. If you're just approaching peer support, how do you find people to give the peer support to? Where do you go to? How do you get matched up?
Is it also a case of not enough peer support professionals? Is this a numbers game that there's just not enough professionals? And is that a funding issue? Is it a reimbursement issue? Is it a budget issue? Like where do we fall short in providing enough people who can go out and then maybe find those who would be interested in getting it? But then also, like, how do you staff any of this?
That's true. I know that a lot of people or a lot of peers who could provide peer support and get employed with peer support can only want to work a certain number of hours. Like particularly, they don't want to have any of their insurance dropped, like say Medicare or Medicaid. And if you do receive Medicare, such as in my instance, I can only make up to $1,200 a month without my Medicare being affected. And I need my insurance for my doctor appointments. If I had to get insurance on my own, it would be way too costly. The human service centers do hire peer support professionals, and they do have a position open here in Fargo. Well, there's no benefits with that position, as well as it's 30 hours a week, which would be well above the $1,200 a month. So a lot of friends of mine or peers who might be interested in that job kind of are balking at getting that job because they would lose their Medicare benefits, as well as being able to work that 30 hours without having support of your own as a peer supporter or having any sort of, connections. It's hard. It's really hard to understand, hard to comprehend. And if something does happen to you where your own health has a setback, what happens to you,
And Patrick, you might want to be able to discuss some of the financial aspects of being a peer support specialist, but I'm going to go back or kind of tack on to something that Siobhan just said, which is more of an ethical issue in general for how does peer support or how ought peer support services work as a job. So, a peer support specialist is somebody that has lived experience, and if you have a lived experience with a behavioral health condition, you are dealing with a health condition that might come up again. So, in this case, let's say a peer support specialist has a mental health crisis of their own. How should their employer treat them? Should they leave their job for a year or be made to leave their job for a year so they can be recovered again? Or should we look at it as any other health condition and allow them sick leave or paid time off? How would you look at that, Siobhan?
Well, I think it should be looked at as any other position. Say if you would get COVID, or say if you had any other health, where you would be able to get paid time off or at least sick leave, where your job wouldn't be in jeopardy just because what you are being hired to provide, that special service as peer support is, that service is only available because you yourself as a peer have that lived experience and have that same, that same health condition. So there definitely needs to be some sort of a safety net for the employees if they are to be peer support professionals and be able to provide the best job that they can provide for each and every individual peer.
And I think you and I have become aware of instances in which that understanding of what a peer support specialist is, as well as just in general, how employers might look at a mental health or other any behavioral health condition coming back up again, and how that they treat their employees. So this could be something throughout many careers, but also it is currently impacting people that are in the peer support realm.
I think so too. I think everybody could possibly have a relapse. You never know your own health. I possibly could. My medication possibly might not work for me in the future, and I might have to go on a different med. I don't think that a person should be punished just because, that they have a health issue. I think that you need to be able to work with the individual and understand where they're coming from without getting let go and have to wait another year and prove that you're okay for a year. That's just kind of hard.
I'm not necessarily aware of other health conditions having kind of that level of, what's the word? Probation.
Scrutiny almost,
Yeah.
Scrutiny or probation period put on you if something happens.
I think so too. I think that there needs to be more understanding and more compassion by employers, and their ability to flex a little bit more with their employees within the peer support and kind of try and understand at least the service that they're providing and what they're providing by sharing their lived experience with another. That is something deeply personal. And when you're working one by one with someone and sharing your own experiences, and they're sharing their experiences with you, and you have a connection and you're able just to work with them, that's a lot. It's wonderful when you're a peer support worker and you're able to connect like that and help someone, but it's a lot on you too personally, and so I think they need to provide more support for their peer support workers too, and more options in case they do, actually have something come up with their health.
Well, you think about frontline workers, right? You think about nurses who are on the front lines, facing a pandemic and the stress levels that they have and the amount of things that they see that they can't stop. And they're constantly dealing with trauma all the time. And that support, there's a lot of support for that. You're talking about something very similar where you have that lived experience, I'm assuming is bringing up and sort of a little more heavy than it is in another job, using air quotes, job. And that would be very appropriate to have a support system that was as aggressive as anything else in the field to really connect at a level that is needed for continued recovery or continued support system.
Definitely, and that's for everyone in every job that encompasses peer support, whether that is, whoever the employer is, I want to say something like that, whoever the employer is. I think they need to have that sort of compassion, because we are professionals too as peer support, offering peer support, sharing our personal experiences, like you said, and that can be very, very heavy.
Yeah. Well, I mean, you're talking about there's a whole lot you can kind of cover in this too, where you talk about workforce development, and you're trying to figure out how to get people to apply for jobs and how to be, everywhere that the state needs. And that kind of leads to a question of where the expansion needs to happen. Is it hospitals? Is it crisis teams? Is it where can we and where should we expand? Assuming that we've got this support system and assuming that we've got a lot of sort of need out there, where's the biggest need as you're seeing out there for peer support, and where do we expand and go from there?
Well, peer support actually, I don't believe is being used in all the places that actually it could really, really be used, in emergency rooms. Also, in person's aftercare plans, after you spend some time in the hospital, perhaps in a psychiatric level care. The plans that people have for their aftercare plans once they get back home or back in the community, I don't believe that peer support is used nearly as much as it should be there. And actually, I don't know of anybody who's ever had peer support as in their actual aftercare plan. I think it could be utilized there. I think mobile crisis units, which I believe that the human service centers have, I believe that their mobile crisis unit teams could have peer support workers there. They do in Minnesota. I know they use peer support workers on their mobile crisis. There are also, in schools, that's a little bit different, but mostly colleges. I think colleges really could use a lot more, with their opening up their mental health to peer support and for other students. That would be awesome. In universities and colleges, pretty much in every other profession as well. There's no actual professionals helping professionals with peer support with mental health in the state. That would be something that would, I think, be greatly needed. I've been asked about that, and there's other folks who have went. Like I used to go to West Central and Southeast Human Service Centers. There's other peers helping others that have been in the Human Service Centers, service center system of care, but not any of the other ones that I know of, other peers that have been in professional, that they could relate to their own professional experiences. I don't have that experience as a professional. I have experience as another consumer would have, from that point of view. Not every peer, I don't think, can help every peer as a perfect match. I don't think that I could maybe help a lawyer and understand their position other than their mental health, as another, professional. So, it's just that there just needs to be more in pretty much any sector, in every sector.
And I would say, Patrick, too, another difficulty is that the use of the word peer has come to mean so many different things to so many different audiences for both good and bad. So in this case, in this field, we're using it in terms of having the same personal lived experience. Whereas Siobhan just mentioned the university level. Whereas the university level, what I'm seeing is when they're using the word peer, they're not necessarily saying somebody with the same lived experience. They're saying somebody that's the same age. So that you wouldn't have somebody that's in their 50s providing support to a student that's 19. You would have a 19-year-old providing support to a 19-year-old. However, their lived experience would just be their age. So they're talking about in terms of students with disabilities being provided services by people that do not have disabilities. So they do not have that lived experience as having a disability or a mental health condition. They just have lived experience as being a young person that's interested in helping people out. So So some of that is also a challenge that we have to get into as peer support workers is helping support as well as differentiate between what's appropriate and what's probably not appropriate matching, and what kind of services and supports we should build up for people.
Yes.
See, I'm the host of the podcast, and I learn something every day of doing this show. It's fantastic. Well, on that note, Siobhan, you've got a bunch of things that we need. Can you kind of maybe clarify, or maybe from your perspective, what sort of improvements need to be made as sort of, regarding how we refer to specialists or peer-to-peer specialists? How do we treat them? Where's our to-do list? If you had, you've got the platform, you've got people listening, what's your to-do list of needs to improve? If we could make a magic wand happen in your hand and poof, here it is.
Okay. Well, I think that we're doing a lot in North Dakota right now, opening up the conversation with mental health. There's always been a stigma with mental health, I guess, or a stereotype. Hopefully we're breaking through that stigma and stereotype more and more, and learning that mainstream folks have mental health issues as well. And you don't necessarily need to be the stereotype, which I really don't like that stereotype, because there is no stereotype now. That, what people are being, the younger generations especially, they're being more open-minded. They're accepting, I believe, people having mental health conditions. And I think that we need to continue to be strong in our schools, our universities, being strong in our recovery centers, being strong with our legislature and our whole state, actually, just being stronger and more vocal and more open and more accepting to mental health in the state, through the nation, and not have any sort of a negative image about it. So that's my main thing is breaking through the stigma, breaking through the any stereotypes. Families have members, and if you went through this, like I said, my folks are my greatest advocates, and they went through a lot with me before I finally was able to find out what was right for me medication wise. I think peer support could be that kind of quote unquote family for others who don't have the parents like my parents were for me, supportive, to help them learn the ropes basically, and help them basically feel like they belong. So that's the thing is that I wish that there was just more open acceptability, and I think we need to keep that going and keep that conversation and keep that positive reinforcement for folks that it's okay.
Siobhan, since you've done a lot of work over the years with CFN and you represented as the current president, how do people get in touch with the CFN, or if they're interested and have lived experience themselves, how can they become members? How can they help out?
Okay, well, at the local recovery centers, there's 8 centers across the state. I'm not so sure about Williston, but there is a place there at the Human Service Center. But there's recovery centers in 8 of the major cities. There is literature there. I know there are pamphlets for the CFN, and also they can contact Mental Health America, North Dakota. They're able to keep in contact with myself as well if they need to find any information or want any information sent with them. There is a website also, Mental Health America's website. They're able to, and we have a Facebook page for the Consumer Family Network actually also that has more information, and the website also of Mental Health America has a page for the Consumer Family Network if you wish to get involved that way. We do have monthly meetings for the Consumer Family Network for the council members, and it's open to the whole public. And that's a monthly Zoom meeting, and you can get the information also if you want to find out more from Mental Health America. Matthew McClary, he is awesome, and Carlotta McClary, they're awesome at getting information for anybody who wants to find out more about us. I live here in Fargo. We have members that live in Bismarck. We have members all across the state in each region, a member and an alternate usually. And they also would be able to be happy to get out more information if needed or asked at the meetings. So.
And to do you service and plugging your website as well as Mental Health America's website, if anybody wants to get to CFN's website, that's ndcfn.org. CFN.org. And Mental Health America of North Dakota's website is MHAN.org.
Siobhan, thank you so much for being a guest on the podcast. Not only is it great to hear kind of your story, but it's great to hear from an individual who has a lived experience, who's working in peer-to-peer, who has seen sort of the challenges and the real sort of headway that we're making here in North Dakota. Thanks so much for your leadership at the CFN. Thanks so much for your perspective today here on the MHAN podcast.
Thank you so much for having me. I appreciate it so much.
We'll have all those links in the show notes, so please make sure you check that out. And we'll talk to you again here on the next episode.
This podcast is brought to you by the Mental Health Advocacy Network. MHAN advocates for a consumer, family-driven mental health system of care that provides an array of service choices that are timely, responsive, and effective. Our vision is for every North Dakotan to have access to the right service, whether it be preventative, treatment, or recovery, at the right time, when the service is needed, and at the right place, as near his or her home as possible. To learn more about MHAN, our advocacy efforts, and literature about the North Dakota mental health system, visit our website at www.mhan.org. Again, our website is www.mhan.org.